হে এভরিওয়ান, ওয়েলকাম মাই ইউটিউব চ্যানেল। তো চলো আজকে আবার কিছু ইম্পর্টেন্ট কোশ্চেন নিয়ে চলে এসেছি। প্রথমে মিড সার্চ অফ নার্সিং করব, তারপরে গাইনোকোলজি করব, ঠিক আছে? তাহলে চলো স্টার্ট করি প্রথমে মিড সার্চ থেকে। কোশ্চেন নাম্বার 1, হুইচ ইজ দ্য মোস্ট নর্মাল রেসপিরেটরি রেট অফ অ্যান অ্যাডাল্ট অ্যাট রেস্ট? Here correct option is option B, 12 to 20 beats per minute. Question number 2, which position is best for patient with dyspnea? Dyspnea মানে ব্রিথিং ডিফিকাল্টি, ঠিক আছে? এখানে কারেক্ট অপশন হবে অপশন সি, হাই ফলোয়ার্স পজিশন। কোশ্চেন নাম্বার 3, which gas is essential for cellular respiration? Here correct option is option D, oxygen. Question number 4, which is the primary muscles of respiration? Here correct option is option B, diaphragm. Question number 5, which ABG value indicate respiratory acidosis? Here correct option is option B, low pH and high partial pressure of carbon dioxide, that means PaCO2. Question number 6, which condition is an example of obstructive lungs disease? Here correct option is option C, asthma. Question number 7, which sign indicate hypoxia? Here correct option is option B, cyanosis. Question number 8, which device delivered the highest oxygen concentration? Here correct option is option D, non-rebreather mask. Question number 9, which sound is heard with fluid in the alveoli? Here correct option is option C, crackles. Question number 10, which condition is caused by collapse of alveoli? Here correct option is option B, here correct option is option D, atelectasis. Question number 11, এটা অনেক ইজি কোশ্চেন, নিজে থেকে দেওয়ার চেষ্টা করবে। which ABG result suggest hyperventilation? কারেক্ট অপশনটি কমেন্ট বক্সে লেখো। নেক্সট কোশ্চেন নাম্বার 12, which breathing pattern is seen in metabolic acidosis? Here correct option is option C, Kusamal's breathing pattern. Question number 13, which is a common symptom of COPD? COPD full form chronic obstructive pulmonary disease. Here correct option is option B, chronic cough. Question number 14, which lab test confirmed tuberculosis? This is a very easy question. Here correct option is option B, sputum culture. Question number 15, which PPE is essential when caring for TB patient? Here correct option is option D, N95 respirator. Question number 16, which signs show respiratory distress? Here correct option is option B, retractions. Question number 17, which test measure lung volume? Here correct option is option C, spirometry. Question number 18, which intervention help clear secretion? Here correct option is option B, deep breathing and coughing. Question number 19, which acid based disorder occur with prolonged vomiting? Here correct option is metabolic alkalosis. Question number 20, which condition cause sudden shortness of breath? Here correct option is option A, pulmonary embolism. চলো এখন আমরা 20টা আমরা কমপ্লিট করলাম হচ্ছে তোমার মিড সার্চ। এখন আমরা গাইনোকোলজি 20টা কোশ্চেন সলভ করব। চলে আসো গাইনোকোলজির কোশ্চেন নাম্বার 1 থেকে স্টার্ট করব। আমি 80টা কোশ্চেনের আগে করে দিয়েছি, এখন কোশ্চেন নাম্বার 81 থেকে আমি 100 পর্যন্ত কমপ্লিট করব। কোশ্চেন নাম্বার 81, what is colostrum rich in? Here correct option is option B, antibodies. Question number 82, what causes physiological anemia during pregnancy? Here, correct option is option C, increase plasma volume. Question number 83. Which exercise is advised postpartum for pelvic floor strengthening? Here, correct option is option B, Kegel exercise. Question number 84. What is the indication for cesarean section? Here, correct option is option B, CPD, that means cephalopelvic disproportion. Question number 85. When does maximum fetal growth occur? Here, correct option is option C, last 8 weeks of pregnancy. Question number 86. Which test detect neural tube defect in fetus? Here, correct option is option C, alpha fetoproteins. Question number 87. What is the function of the umbilical cord? Here, correct option is option B, supply blood, oxygen and nutrients. Question number 88. What causes uterine atony? Here, correct option is option D, all of above. Question number 89. Why is exclusive breastfeeding encouraged? Here, correct option is option B, boost immunity. Question number 90. When does lochia become alba? Here, correct option is option C, after 10 days. Question number 91. What is the first response of a newborn after birth? Here, correct option is option A, crying. Question number 92. Where is the ideal site for giving vitamin K injection to newborn? Here, correct option is option C, anterolateral thigh. Position is vastus lateralis. Question number 93. What is the shape of the gynecoid pelvis? Here, correct option is option D, round shape. Question number 94. Why is oxytocin administered in the third stage of labor? Here, correct option is option B, control postpartum hemorrhage. Question number 95. What is the purpose of the biceps course? Here, correct option is option C, assist cervical favorability. Question number 96. When is the second stage of labor considered complete? Here, correct option is option C, delivery of baby. Question number 97. What is the risk of preterm rupture? Here, correct option is option B, infections. Question number 98. Which supplement reduces neural tube defects? Here, correct option is option C, folic acid. Question number 99. When should breastfeeding be initiated after birth? Here, correct option is option C, within 30 minutes. Question number 100, and this is the last question. What is the normal duration of the third stage of labor? Here, correct option is option B, 5 to 15 minutes.